Hey, good day. Hey, this is Kelly Jones. I'm coming live from you from South Carolina. You'll be able to tell that in my my voice, I'm sure. I'm looking forward to being in Cincinnati and my I guess Northern Kentucky too. My my presentation is about wellness visits and trying to achieve optimal wellness, even if that's possible. So I bring a Christian note in here too, because ultimately wellness is, I think, all about a person, in Jesus Christ, for sure. And we'll talk about that more in a little bit. But that's what we're going to talk about. One of the key things is, and I don't have a whole lot of time, so I can't elaborate. I've got to do this in sort of a scaled down version. So I'm going to try to get all of this in and help you understand kind of where I'm coming from about this. But it is tough to achieve. Can you achieve wellness in someone? Is it really is that a real word? I personally like well-being a little bit better than wellness. So we'll look at that as we go through. This is my pharmacy that I helped develop. One of the founders of the pharmacy, and worked there for many years, and have kind of doing more now at McLeod Health or McLeod Hospital, teaching more family medicine residents. That's kind of what I do. I'm involved in the office care of them, of their patients and things like that. That's typically what I do now, although still very active in the pharmacy. And I always love the drive through because you get to drive through. You could always have a lot of fun there. And of course, I would bog up traffic and everything else. So that's probably not the greatest place for me to be hanging out talking to people, because that's what I like to do, is talk. So let's look at this wellness aspect. And I disclaim no one here is supporting me to be there and is funding this discussion. This is me. You get my biases, I guess I should say, really. And what we're going to do objectively, we're going to analyze this and look at wellness and try to look at how pharmacists can be involved in this at some level. And look at the rationale behind it. Look at where other places we can be involved in this, and we're going to look at definitions and that type of thing to sort of get a good grasp of what's going on here. Now, here's my definition of wellness: eat well, stay fit, die anyway. So that's my joke of the day. I did have a friend that was a physician who had this as a bumper sticker on his car. We used to laugh about it immensely. So I hope you'll get a giggle out of that. That's the point of that. But there's somewhat that's a real true statement. Eat well, stay fit, die anyway. One thing I would tell you, I'm always a book recommender. I love to read, and one of the books about this, that if you're going to be a person who's just into the wellness, then you need to read this book by Norton Hadler, who comes out of the University of North Carolina. Not sure if he's still there anymore, but definitely was a pretty famous author of stuff like this. And it's called The Last Well Person: How to Stay Well Despite the Healthcare System. So there's the angle that you got to think about here. Wellness is, you can overdo it at a doctor. Doctors can actually, and medicine in general can hurt people as easy as they can help people. Another book I would immensely recommend, this one, is Overdiagnosed: Making People Sick in the Pursuit of Health. Now this is Gilbert Welch. He comes, I think, out of Dartmouth, in that area. He is a genius with this, and you can find some YouTube lectures on this discussion, which I would advise all of you to look at too, because I think you need to broaden your thinking on wellness in a sense. I think as a term, it's kind of misused in my mind. I mean, here's real wellness. My flesh and my heart, but made well, but God is the strength of my heart and my portion forever. So really, truly, to me, true wellness is biblical here. I think, and I think of Psalm 73:26. I think is probably a great great verse that I think we all should think about. That's where our true strength is in our Lord, and that is the key to wellness. It really is. I mean, it's nothing. It's as simple as that in a lot of ways, for sure. Excuse me. My flesh and my heart may fail. That was right. I had it covered up there. I got it. There we go. Anyway. And one of the things I want to discuss is longevity. It has a real issue, and I'm going to show some data at the conference, a little bit, because I have a little more time to do that. And this, one thing I want to kind of focus on is that, if you live to be 80, you've done something. You've lived a lifetime in a lot of ways. I mean, if you're a male that lived to 80, man, you've done it. You've beat the odds. You've beat it. You have lived a lifetime. Is that all that matters, though? Well, that's always the great question, because most people, when they get 80, will say, I care about my quality of life, but I also care about the quality of my dying. Those are big concerns. And things like they get to this point when you get older, as you live longer, you think disease becomes, it transforms into dis-ease. More so, things that just limit how and who you are and what you're able to do in a day is kind of where you want to spend your time in your life. The question really is not how we can be assured we will live to be 85, but how we can aspire to be purposeful and self-assured for those 85 years. And, so does preventative medicine work its role in here? I don't think it does in a lot of ways. I think preventative, especially with pills, wellness in another way, I think, or preventative medicine in another way can be helpful, but pills, probably not the great thing. And as we pharmacists kind of think about, because everything's a pill oriented because we're pharmacists, that's kind of the idea. So what he talks about, Norton Hadler does, which is really interesting, is that, watch this for a second. I'm going to explain this the best way I can, as quick as I can. But if, let's say, you're, 25% of your mortal hazard, the mortal hazard is what where you fall short of living to be 80. Let's say, for example, our mark is to live to be 80. Well, you're, you made it 76. Well, you missed it 4 years. Now, you and I would say, man not know his time, because that's biblically what we see. The Bible tells us that. In the science sector, the research sector, says things, well, you missed it 4 years. What happened? Why did you miss that? Well, and their data kind of correlates out to, 25% of that is due to, you smoked, too long, you were overweight, your cholesterol was bad, you had all these health behaviors that were not so great. But the other 75%, not 25%. So you missed it 4 years. So 1 year loss is related to those things I just described. The other 3 years you lost is probably related to the things listed. 75% are related to community type things that we would think about. You never loved your job, you were poor, you're ostracized, you were lonely. I mean, there's no faith, the lack of faith there. You're not happily married. All those things play huge roles. In fact, Hadler says it in the little red box there. He says the secret to longevity are the fine structures of human ecology. Now, that to me is a little bit sterile word, so I like to change it and say the secret to longevity are in the fine structures of human relationship. And I think that is the key aspect to longevity, and in a sense, aspects of what we're trying to achieve, I think, with wellness. So we'll look at that throughout this presentation for sure. I'm going to move my body over here, down here, so I can read this. It seems every healthcare organization this is a sort of a self-assessment question. It seems every healthcare organization has a definition of wellness. We will review 4 definitions. Which word runs through all 4 of these? Without, active, survival, avoidance. And if you let you stew on that second, but I can't, I'm gonna move on. The idea here would be active. It would be shows up in red there, the active aspect of wellness. So here's Webster's dictionary. It's the state of being in good health, especially as an actively pursued goal. See, I think that's the key part of all these definitions. Probably Pfizer has a good one too, but probably the real aspect of this is it's a pursued goal. It's second one there, the condition of good physical and mental health, especially when actively maintained by proper diet, exercise, and avoidance of risky behavior. Yeah, it really, and that's probably, I like that because diet, exercise, avoiding risky behavior, it really doesn't say aspirin, statins, things like that. It's not drug related, which I think, again, we don't have time to poke through all of that, but wellness is not about how many medications you're taking. Trust me. Wellness is the act of the other Pfizer one. I love this one. Wellness is the act of practicing healthy habits on a daily basis to attain better physical and mental health outcomes. So that instead of just surviving, you're thriving. I love that part of it. So again, it's an active, that's that word there, but you're surviving, not just surviving, but you're thriving. And the World Health Organization lists another one. It says the wellness is defined as an actively state of complete physical, mental, social well-being, not merely the absence of disease or infirmity. So I like that. It's actively a state of complete physical, mental, social well-being, but not just like you're free of disease. That doesn't necessarily compensate or give us the right definition for sure. Self-assessment question number 2, the concept of wellness can be confusing. Which of the following statements best reflects the main tenet of wellness? So the main tenet of wellness is to be happy. That's what you'll often hear in this day and age as we think of more of who we are as our feelings. Another book you ought to read is Carl Trueman's book on the self. Strange New World it's called. Great book about this kind of thing. B, that you're in good health, that you feel like you're in a state of well-being, making choices that lead towards an outcome. So hopefully you get this one right as we just looked at. And, that would be D, making choices that lead towards a good outcome. That's what we're kind of seeking towards. Wellness is often a confusing idea. It can be. It's often confused with health, well-being, and happiness. Just that. Wellness is not a static state of being. It's not just, hey, I feel good and I'm well. Again, I don't know how you sure wellness in anything or anybody, but I think it is an active process, looking towards goals, choices, and things like that you can make that are good for you. So a wellness lifestyle step plan. It might look something like this: social connectedness, exercise, nutrition, sleep, mindfulness, like a meditate type of idea. Kelly Jones might throw in, this is kind of my way of looking at it. You want to be socially prepared, go to church, exercise, eat right, get a good night's rest. Be mindful. What? Wear a seatbelt. Don't smoke. At least quit by 40. Do something that you think is positive for yourself. I think that would be another key piece to wellness. So that's kind of how I see wellness for sure. These foundations can be holistic and natural. Self-care can be another idea in this as well. It can be that. And again, preventative care is a part of this whole idea too, for sure. One of the things I wanted to kind of discuss with everybody is how can pharmacists be involved in physicians in trying to do wellness. Everybody knows Medicare has wellness visits that you can do and that doctors are supposed to do. They get one per year in a patient, and you're supposed to do that visit. It pays well. And in that yearly visit, you're supposed to develop or update your personal plan to help prevent disease or disability based on your current health and risk factors. So that's the Medicare wellness visit, which is an opportunity for us pharmacists, because you got all this wheel of wellness, here, where you got the meds, your provider care, who is involved in that, surgeries, hospitalizations, heights. You can look at these, as you can see these, and there's a lot that goes on. I'll have one with me right at the moment, and I'll try to bring one, but it's a big old thick piece of paper that you got to work through. And there's a lot of pieces to that, and there's a lot of filling out that you have to do. And there's various models pharmacists work in this environment. But if you don't know, they're pharmacists in HQFCs, and they're pharmacists in just private offices, where what they do is they do these wellness visits. We've learned that we're leaving a lot of money on the table. Lots of money on the table. And we discovered that if you can easily hire a pharmacist to go in and do these. If they bill, it's even better. HQFCs, you can't bill. You kind of bill up under the doctor, and the doctor bills that service. But that amount of money that comes from that can easily pay for a pharmacist to help do these. We got some going on in our community where they say they do about 8 or 9 wellness visits a day. It's integrated system. The pharmacist tells me that if they could just be by themselves and didn't have to integrate too much, then what they would do, they would probably do 14, 15 a day. So there's quite a bit that you can get done. And there's a lot that happens from this kind of thing, because I don't have time to go into each individual thing in the wheel is another whole set of ideas. I mean, you think about meds, reconciling meds. I mean, it's key piece of this. And then like surgeries, what do you need to screen? That whole thing kind of pops into all of this. And so there are different models of this, but the key thing is that pharmacists can be actively involved in this. The main rationale or goal behind the Medicare wellness visit is to what? Address gaps in care, improve patient engagement, promote preventative care, reduce cost, all the above. Yeah, you probably gain, if you're smart and thinking through this, you'd say, yeah, it's all the above. Yeah, sure. I mean, it's all that you address gaps in care, improve patient engagement. All these things are designed to be a part of what a wellness visit is all about. So pharmacist-led annual wellness visits, the idea of the wellness visit is to reduce the cost. It helps in that, addressing the gaps in care, improving patient engagement, promoting preventative care. Pharmacists are in a position to conduct these visits under supervision of a physician. It's wonderful. I mean, that's a great thing, and that can happen. And there's a lot of good things you can do. There have been several research trials of pharmacist-led annual wellness visits, and there have been. Some are better than others. Which of the choices have been shown to be beneficial outcome from this research? Mark all that apply. Community pharmacies can establish a relationship with a practice to provide an annual wellness visit. Pharmacist-led visits pay 50% of what a physician-led visit would be. Annual wellness visits conducted by PharmDs were non-inferior to physician-led. So, I mean, they were just as good as a doctor doing it. Physician-led visits were better at discussing vaccine needs than pharmacist-led visits. Physicians were satisfied with that. They were satisfied with using the PharmD for other services as well. So if you mark some of those and go through, and again, we're going to take time on move on, but those are the ones that are in red are what we find that are very beneficial. Community pharmacies can establish a relationship with a practice to provide annual wellness visits. You can do that. Absolutely, you can. Annual wellness visits conducted by PharmDs were non-inferior. That's true. In fact, some were even better. And for sure, that point there, the physicians-led were better at discussing vaccines. No, quite the contrary. The pharmacists were. They did a wonderful job. And the physicians were very satisfied with the PharmD services, because not only do they do wellness visits, they can do drug informational visits and things that they need. And a doctor can call on you to look up something, get some research. There's so much that can be done in that setting. Some of the literature came out in I think 2020. This is a systematic review. It's 2021. It's a systematic review of the literature. There were 11 reports that were included out of 139 citations. Pharmacists have a huge role in sort of putting it all together. Some outcomes noted that PharmD salaries are easily provided through billing, and PharmDs have a higher rate of medication and non-medication related interventions than non-PharmDs. So able to actually, especially, you think, well, the doctor would know a lot more. No, I mean, they don't mess with this kind of thing. I'll be honest with you, the ones I know can't stand them. Annual wellness. They can't stand doing these things. So that's why we can pick this up. It's a great opportunity. It's almost like back in the old days, how did pharmacists get so involved in the clinical side in hospitals? Well, we did it through pharmacokinetics. We used pharmacokinetics to say, hey, this is complicated stuff. We'll take care of this for you. And the physicians, like, the ones that really wanted to spend more time with their patients were like, yeah, please help me with this stuff. And so it's very, very different. And so nowadays, I think this kind of comes into play that helps push us pharmacists into the outpatient clinical side of things is doing these kind of visits, which is really awesome. Some outcomes noted in the review, some more. Community pharmacies can establish a relationship. There's no doubt that happened in that study. They provided interprofessional education for students. The wellness visits conducted by PharmDs were non-inferior. PharmDs provided a higher rate of vaccine advice and screenings. Patients were overall satisfied with the pharmacist. That was kind of great too. And MDs were satisfied with them for that service and other services that they were able to offer them. I would tell you to go to. I don't have a economic aspect of this. I don't belong to any of this, but I want you to see our pharmacy called The Pharmacy. We went to the Avant Institute, and it's in Charlotte, North Carolina, and trained in this kind of stuff. There's actual places where you can actually train in this, which is pretty cool. There's Moose Pharmacy out their website. They're in North Carolina, big pharmacy in North Carolina. But the Avant Institute helps train you in all this wellness and billing and all this understanding. And you can go to their website and look at it. Again, I have no financial interest in this, so I just want you to know that. What is the pharmacist's role in wellness? Well, I just like this. The medication optimization tends to be a kind of good definition here, which is an approach to medical management that focuses on all aspects of the patient's journey, from initiation of treatment to follow-up to ongoing review and support of their medication treatment plan. So I kind of like those ideas. Medicine management is initiation of treatment or deciding about the discontinuation of the treatment, follow-up, ongoing review, and support. I think that's what can happen after a pharmacist gets involved with a wellness visit of a patient, and they can follow that even over the course of time. Self-care is another great wellness opportunity for you, and believe it or not, it's great. You can seek care through your pharmacy. Pharmacists, don't forget, man, you have a lot of over-the-counter medications that can be very helpful to you. And remember, people bring a lot to the table. They bring a lot of fear and finance issues, and you can do a lot of things to help them with things for sure. And so there's a lot of self-care ideas in wellness as well. So, and I think here self-care kind of begets wellness in that, disease prevention through healthy lifestyle is key. We can promote some of that. Self-care in a pharmacy is a form of health promotion. I believe that personally. You can not only help a patient with dietary supplements, but you can help them with the basic treatments and issues with over-the-counter medications. So that's pretty awesome as well. And you can do some basic screenings if you wanted to, although that can be kind of controversial. Of the list, what other wellness opportunities can the community pharmacist be involved with? Check all that apply. diet, weight and diet, exercise, sleep, smoking, cessation, alcohol moderation, ASCVD assessment, blood pressure screenings, cholesterol, finger sticks. No, what are we involved in that? Well, yeah, you can mark them all. We could be involved in any and all of these assessments. You know, I think, again, what's our role here? You see all of these things like, of course, annual wellness visits in the doctor's office is going to be a great thing. Blood pressure screening, cholesterol screenings, finger stick, stuff like that. I would question, I would help you understand from someone who's worked in the clinical side and worked with doctors all my 35 years of practice life. Really and truly, they're like, I hate when pharmacists do these things, because what happens is you give the person numbers, and the numbers, what if their blood pressure is really high? What do they do? Well, you send them to the ER. Then that, is that the right thing to do here? It's a real question about that. I'm sorry, but I kind of agree with doctors on this. I think we have to be careful with what we actually can do with those results. Do we send them to the ED? Do we hand them a piece of paper and instruct them to go see their doctor? So I personally, my act of wellness when I was at the pharmacy in that environment was making sure they had a primary care physician or some sort of practitioner. I would spend my time trying to get them to a person that could actually see them. That was my way. I thought that's the best wellness that a pharmacist could do, is getting the person, not check their blood pressure, not check their cholesterol and hemoglobin A1C, but to make sure they had a primary care doctor. So here's some other things you can get. You can be involved in weight and diet, exercise. You can be involved in any and all of these. And I could give you some data on how that pharmacists improve these things. You can help with ASCVD assessment. Yes, the little calculator. Get it, Google it. You'll find it, and it's easy to put information in there. Like here, I can get a 66-year-old cholesterol, HDL, blood pressure. You just click all the different risk factors, and it gives you an assessment that you're 42%. Let's see, let me get my face out of the way. 42.4% of you have a 10-year risk of having a cardiovascular event. If you do everything right, if you do your best at risk factor reduction, your percentage would be 9.6%. And so you can show that to patients about why they ought to take their blood pressure medicine, why they ought to take their cholesterol drug, help them understand if they can improve on those risk factors, that they can drop their risk of having a heart attack in 10 years from 42% to 9% in this particular patient. So a lot of great stuff. I used to do this with patients at the pharmacy for sure. So there's a lot of different ways you can be involved. But I do say that probably one of the best things we've done has been immunizations. That's another definite one that's been very much involved. The Bible talks a lot about wellness, and it, wellness to me is a person. It's Christ. It definitely is. Be not wise in your own eyes. Fear the Lord and turn away from evil. It will be healing to your flesh and refreshment to your bones. These are the things that are wonderful. Train yourself in godliness. Have a joyful heart is good medicine. I love it. And I love what Christ said to himself on his mission when he was in his missionary work, and starting his whole thing. He compared his work to a doctor. He said, and when Jesus heard it, he said to them, "Those who are well have no need of a physician, but those who are sick. I came to call the righteous, but I came not to call the righteous, but sinners." So that's my take on wellness. A little 30-minute update there. I'll be expanding on a lot of this at the conference in a lot of ways, but it's pretty amazing stuff. It really is. It's wonderful. It's really cool that pharmacists can be involved in the whole well-being aspect of a patient, which is what I kind of like better. I hope you enjoyed this. I look forward to being at the conference. Hope to see you around there. Maybe that'd be great. I'd love it. And I thank you very much. Take care and have a good rest of the day.